All right. What's up? Today is Friday, August 3rd, not 13, 30. Oh, let me check. Because I don't know how to say that. Um,
30 and date. August 30th.
August 30th. I didn't know what to say that. So today is August 30th, and it's a Friday. And I don't work in the morning on Fridays anymore, so I kind of have like free times to actually do whatever I want. And what I decided to do today is study. Well, I have to go to work later in the afternoon at like 7, so I'm gonna have like another 12-hour shift. So it's gonna be like from 7 this afternoon to 7 tomorrow morning. So I decided to study for the first half of the morning, or just the literally morning, to be honest. Well, we're gonna say first half because I first need to go get some clothes. I'm gonna go thrifting because I'm gonna go out on Sunday to this concert. So I actually need to go and get some new stuff to put on because I generally don't have anything that I can wear. And then I'm gonna go on campus to study. So I already packed some of the food that I have now, so I just packed some stuff and put it on my lunchbox and put it on my car so I can have like some stuff, to eat probably throughout the day. But I'm thinking about going to Publix and get a subs to start the day and get some fruits too that I'm gonna be eating for the whole damn day, cause they're just that good. Cause I like kiwis, and I'm just gonna get like a box of kiwis and then I'll just eat them as small little snacks throughout the day. But yeah, that's not the topic of today's video. So today's video is something that I had to talk about yesterday. But the thing is, yesterday I forgot. I didn't forget. I was just not in the mood to record anything. So that's one of the reasons why I was just like snatched out. I'm not gonna record anything. So I'm gonna try to do like 2 videos today and actually talk about this stuff that I have to talk about. And today's subject is what is like being a patient tech, my daily routine explained. And this video is perfectly plain. And the reason being is right now I have a routine which I didn't have like 2 weeks, maybe 3 weeks ago from now. And I can actually talk about it and actually guide you guys to how I developed my routine and how is my routine kind of helping me at work now. So let's get into it. So for those who don't know, I'm a pre-med and I'm also a medical scribe and a patient tech. So medical scribe and patient tech are 2 different jobs, 2 different scope of practice, if I can say. If they do have a scope of practice, because scope of practice is what you're allowed to do within your job. So what I'm allowed to do as a scribe is not the same as what I'm allowed to do as a patient tech. So as a scribe, I just do, I'll say, desk work. So I just type and I do not touch the patient. I'm not required to touch the patient. I'm not allowed to touch the patient, and I'm not allowed to do any patient tech jobs. And it's 2 differences to hospital system, so it just makes it even worse, to be honest. And as a patient tech, so I can do scribe work, but I'm not in any situation to do so, because what am I gonna scribe? I don't even talk to any providers, to be honest, as a patient tech at this hospital where I worked at. And I only do patient tech jobs. So I clean my patients, make sure that they are fed, I make sure that they are ready for the day or ready for the night based on which shift I pick or choose. And that's pretty much it. So different scope of practice. So I hope that I gave you guys kind of like an explanation on what both of them entails or what they are. And what my routine looks like is the job is from 7 to 7, but more specifically like 7 p.m. to 7:30 a.m. So from 7 I will go on huddle. So huddle was a pretty new thing for me, because as a scribe you don't have to huddle. You don't have to really talk with the whole team that you're going to be working with, because most of the interaction that you have is with the providers. So the provider you're working or maybe assigned to, so you don't really have to talk to the team of nurses. So you don't really have to get to know how the whole department is doing, because it does not really affect you, to be honest. But as a tech or as a patient tech, knowing those information can kind of help you and give you some kind of idea how your day or maybe how your night might go. If, for example, we have a confused patient, knowing that we have a confused patient on the floor and to be at the lookout is pretty important, because you never know when this confused patient will try to go home and use the elevator and nobody knows about it. Like, for example, so what if you have a confused patient that can ambulate and you just don't know? So you're just stuck. At some point, they dress up, they go to the elevator, you say hi to them, and then they just go home. So that's, kind of like one of the reasons why you need to know what's happening on the floor and kind of like what to expect, and report them on huddles. So huddles are like small little meetings that you have with the whole floor, and nurses, sometimes the provider might come and say hi, but doesn't really happen all the time. And so it's mostly like the nurses, the techs, and the nurse chief for the shift. So we're just gonna talk about different patients and how the patients are doing, and what we need to take a special look on for the whole shift, and what we need to also expect when it comes to medication scanning, and also something called hair strips that they are always complaining about some nurses not doing on time. So yeah, so we discussed about those things, and based on who is doing it, to be honest, so it can be short or long. So if it's, I'll say, new grad doing it, I'm saying new grad, not to use in the context, but just to use as, I'll say, somebody who's been in nursing like for 5 years, with somebody else been in nursing for 30 years. So it's gonna be like two different huddle types. Like the one that been doing nursing like for 5, maybe like 6 years, the huddle session will be straight to the point, really quick, so nothing really long. But the one that has been doing nursing like for 30 years will have like, I'll say, 5 and maybe like 15 minutes huddles, and talking about every single thing, and which is really good, but sometimes just like repetitive, saying like the same thing over and over again, like, nurses, please do your hair strips, like, come on now. And yeah, so that's one of the reasons why huddle time might be different from wherever is doing it. But huddles are really important, and they're like short, low meetings that we have with the whole staff before we start our shift. So huddle might be from anything to 7, like 2 minutes to 15 minutes sometimes, I'll say. And then after huddle, we get reports, so it's gonna be round 1. So we do multiple rounds on the 12-hour shift. So it's gonna be the first round with whoever was working on the patient or with the patient before. So we're just gonna go on every patient that we're assigned to, and we get report from them. So the type of report that I usually get from my patients, or the diet is really important, because I want to make sure that I know what my patient can and cannot eat for the 12-hour shift, because sometimes they might ask me something that they're not allowed to eat, and then I just, for example, did not know about it, and then I give it to them. So this could have been a problem. Let's think about something that they might be allergic to, or something that they should not be consuming because they're taking a specific regimen, and then I didn't know about it and just give it to them. So that's one of the reasons why, or maybe multiple reasons why, knowing what your patient can eat is really important. And then I get the status. So are they total, or they soft, or they assist? Total means that they are bed bound, they cannot do anything for themselves. So it's usually patients that are I'll say post-surgical intervention. So those patients are going to be total, and they're going to have like a catheter, so they'll just like bed bound. And then we have the soft patients that might come in for reasons that are unknown, but they're still here, but they can ambulate, they can do stuff for themselves, so they're going to be soft. And then we have assist patients that can pretty much like do stuff for themselves, but I'll say that they are old, or I'll say they have like arthritis, has a medical condition, so it's gonna be really hard for them to ambulate, right? And so we just need to help them ambulate, and just kind of like take a look at them for the 12-hour shift when they're gonna try to move around, because they might fall. They're kind of like risk fall patient, or they are, I guess, if it makes sense. But yeah, so we get the status, and the other thing that we get is if they're diabetic or not diabetic. That's really important too, because if they're diabetics, so we need to check their glucose levels like 2 times in the shift. So I think every 6 hours, I think, don't quote me on this, but I've been doing it like for kind of like quite a few now, and I don't even know how long I should do it, but I know that I usually do it at the beginning of my shift and almost when the shift will end. And so yeah, we do it 2 times on our 12-hour shifts, and then that's pretty much it. And after, round first, whoever was working with the patient before will just go home, and then you're gonna take over. The first thing that you do, you take vitals. That's what they taught me. You take vitals, and then if you are working in the morning, you give the patient water, because you're gonna be asking for water, of course. You just woke up. And then what you do after that, it's up to you. But the way that I started doing it recently is I come in the patient room after round one, right? I take vitals, and then I take a look at what the patient might need based on the patient's status, for example. But one thing about me is if I come in your room or your patient assigned to me, your bed is gonna will be changed no matter what, because for me it's dirty, it's filthy, so I need to change it. So I'll come in the patient's room and I'll take a look to what they want, or I will ask them what they need. Sometimes they know, sometimes they do not know, but I'll give them water because they're gonna take medication on 12-hour shift for sure. When the nurses will pass meds, so they actually need water in the room, and then I'll come with stuff that they might need, like new blanket, linens, and stuff like that. Change their beds and kind of like get to know them a little better, and the reason why they came in at the hospital. Which sometimes they have really good stories, and other times they just don't want to talk to anybody, and I kind of get it because not everybody likes hospital. I like it because I get to learn, but then they're here because they have something that needs to be fixed, or something that somebody just told them they cannot fix. So I kind of get that. So you talk to them, you make sure that they have everything that they need, and that'll be pretty much a good start for a 12-hour shift. The way that I used to do it before is I take their vitals and I don't come back in the room until they need me, and then that'll be pretty much it. But with times I realize some stuff, and those stuff that I realized push me to do stuff a little different, and I am more on the, I'll say, direct care area more than anything. And the thing that I mean by this is, for example, like when you have 10 or maybe 8 patients assigned to you, right? So those patients are gonna have needs that they will want you to actually fulfill exactly when they want it. But the thing is, you're not the only one working with the patient, so actually anybody can do that. So one thing that I realized is, if, for example, I'm working with 8 patients, right, and I'm in one patient's room and I'm helping this patient do a specific thing. So if one of your patients call you, please do not just stop what you're doing and go to this patient room. The reason why is there's other nurses, and there are also other things that might be free at the time and also help them. And I've also learned how to put my focus on one patient when I'm helping them around and helping them do stuff, because not everybody like it. So some people just want you to be dedicated to them, be focused to them when you're helping them doing something, which I get sometimes. But if it was something really important, there is different type of call. Like, for example, if a patient just fall, I think there is a call for that. And if the patient have almost crash, or the patient crash, there's a call for that. So you will know why somebody's calling you based on how they call you. And you also have not pagers but phone. So my hospital give me phone, so anybody can just like give me a call and tell me so somebody need something in room 1 to 3, so just go there and do it right now. And if it's not like one of those things that I just talked to you about, so if I'm in a patient room and I'm helping them do something, so I'm generally not gonna leave it to go to another patient room and help them do something too, because I just learned that it's a really bad way to do it, and I've got in trouble just for doing this, which is ironic, right? Because I'm trying to help as much people as possible, but the thing is, not everybody likes it, and I just learned how to deal with it. So I would just like defer the tasks to somebody else, or just let somebody else take care of it and finish what it is I'm doing, and then go help somebody else if they want me to, or come back and follow up on what was needed for me that I was not able to do, and then do it if I still need to do it, if it was not urgent, or just don't think about it because somebody already handled it. And another thing that I've learned from this job is never leave unfinished business, because it will be taken against you. So it might be something that somebody else will just take against you. For example, if you're taking supplies, right, and for some reason you left your carts in the, I'll say, cleaning area or maybe the supply area, knowing damn well that you're taking supplies and then you're not able to finish so because you were helping a patient, somebody else will see it and then report it and says that you've been doing this like for how many days now, and then they just cannot handle it anymore, knowing damn well that it's not a problem, it's not affecting anybody. So never, I'm telling you this again, never leave unfinished business, because somebody will have something to say about it whether you like it or not, and they'll try to make a valid point, and trust me, you don't want to deal with that. So that was kind of like my routine and what I've learned from my job, to be honest. And I'm gonna do like a small little review from 7 to 7, a 12-hour shift. First round, so you go, you talk to your patients, you take vitals, and you get to know what they need, and then you leave the room, you take all the patients' vitals, and so you're done. And then I do my second round when I go in the room and I give the patients exactly what they need and what I'm gonna be using with them, like for the next 12-hour shift, for example, like linen, and if I have to clean them, like clean stuff. So I'll just leave it in the room. So that's gonna be second round. And third round is me check on the patients that maybe are diabetic or taking a specific regimen that need their blood sugar to be checked. So I'll just go and round on them and take their blood sugar and then leave. So that's gonna be third round. And fourth round, so I go back in the room and I help those patients that are total to actually do what they need to do. For example, like getting ready to go to bed or get them water if they want to. That's gonna be fourth round. And fifth round is gonna be me going back and then take the patient's vitals again, because it's gonna be close to midnight, and that's when I typically do them. And then sixth round is gonna be after that another vitals too. So I'll take those patient vitals again, but it's gonna be like 4 in the morning, 5 in the morning, and then the last round will be. Now, before the last round will be me checking those patient glucose level again, because we check them 2 times throughout the shift. And then my last round will be give report. So kind of have like 9, maybe 8 rounds like for the whole 12-hour shift, but I might do more than that if the patient